Hello, everyone. Welcome to another review class for our practitioners from the Philippines. Today, we shall be analyzing the tongue that indicates spleen yin deficiency, or how does a tongue with spleen yin deficiency looks like. Okay, so if you see cracks on the sides of the tongue, so imagine the sides of the tongue, and you can see cracks there. So that means um, the spleen qi and yang deficiency is long-standing. So if it's long-standing, remember it will become deficient in yin, no? So remember, it doesn't remain as yang deficient all the time. It will always transform sooner or later to yin deficiency. Okay, so this is a very chronic condition. In clinical practice, we often see these tongues in conjunction with deep physical exhaustion. So if you see a patient who's so tired, who looks very tired actually, okay, expect the tongue um, to look like someone with spleen yin deficiency. So okay, if so, how do you differentiate this from spleen qi deficiency? Remember, spleen qi deficiency can evolve or can deteriorate into spleen yang deficiency. And so if the spleen qi and yang deficiency are unresolved, this can progress into spleen yin deficiency. Okay, so how are you going to differentiate spleen yin deficiency from spleen qi deficiency? In spleen qi deficiency, you don't actually see much signs. All you can see is that it's pale, the tongue body is pale and swollen. That's it. So you will have to rely more on symptoms. So the hallmarks of spleen qi deficiency are fatigue, diba? Loss of appetite, yan. Okay, when do cracks arise? Of course, we always equate the presence of cracks with heat and dryness, no? So if there's too much heat and dryness, this will eventually give you dehydration. It will injure the fluids and eventually the yin. The fluids first will be deficient, and then the yin becomes deficient. Okay? Okay, so this can injure the yin. Therefore, you see a lot of cracks on the sides of the tongue. Now, we know for a fact that nutritive qi is being stored in the spleen. So spleen yin is the basis of nutritive qi and blood. Spleen yin controls body fluids, the sea of fluids, and it supports the production of blood and fluids. Thus, it moistens and supports the stomach yin. So the spleen and the stomach, they are like, they have a very mutual relationship. Now, spleen yin exhaustion develops very slowly over the course of years or during serious illness. So you don't see this most of the time, especially if the patient is very uh, conscious about his health. No? However, if you allow the spleen qi deficiency, then spleen yang deficiency, okay, after how many years it can give rise to spleen yin deficiency. And this time you will see a patient who is so physically exhausted. So stomach yin deficiency can develop quite quickly. So that is the difference, no? So in fact, this is what you see very often in the clinics. For example, through externally contracted illness with fever and sweating or poor eating habits. So this is something that you see very commonly, no? So splenian deficiency or splenian exhaustion takes it occurs very slowly, no? Unlike stomachache deficiency, which happens very fast. So what are the typical symptoms of stomachache exhaustion so that we can differentiate this from splenian deficiency? No. Okay, so there will be dry mouth and throat because there is yin deficiency. There's constipation, stomach pains, and thirst that can only be sated in small sips. So the patient is thirsty, but he doesn't drink too much. He just drinks by SIPs. Okay, that's stomach yin deficiency. Okay. Now, spleen chi deficiency that has existed for a long time serves as the foundation for spleen yin deficiency. Because of this, the symptoms will manifest primarily as digestive problems. So besides the well-known symptoms of spleen chi deficiency, so as a practitioner, you should be very familiar with the classic manifestations of spleen chi deficiency. Fatigue, no? Lack of appetite, soft stools, weakness in extremities. That's spleen chi deficiency. So other symptoms, of course, this will also be found in a patient with spleen yin deficiency. So all the four plus dry lips, okay, wasting or difficulty in gaining weight and emaciation. So you have a patient who's, losing weight already here. Over a period of time, yin deficiency will cause loss of substance. So how will it manifest on the tongue? You will be able to see transverse cracks on the side. Remember, it's transverse, no? If they appear, okay, the presence of the transverse cracks on the sides plus a red tongue, so this is spleen yin deficiency, okay? So uh, transverse cracks on the sides plus a red tongue body, this means you have spleen yin deficiency. Okay, spleen and stomach yin deficiency can be responsible for peeled tongue coating. Okay, the tongue is pale red or red. It shows irregularly distributed coating, especially for a patient who's been taking too many medications. No, so peeled coating is shiny like a mirror. We have discussed that last time. The tongue papillae in these areas are not visible. So let's now go to the cases. So we have here the tongue of a 46-year-old female with the following symptoms: chronic cough with expectoration of thick phlegm. Okay. Occasional difficulty with breathing, sneezing fits in the morning. How many of you can relate to this? This is quite common, I tell you. Runny nose, itchy eyes, dry mouth, premenstrual syndrome, short menstrual cycle, 21 days. Uh, she consulted a Western doctor. The diagnosis is chronic bronchitis because of the obesity of the cough with thick phlegm, no? So background to disease, the condition followed pneumonia 2 years before. So this patient has had pneumonia. So let's describe the tongue. The tongue is pale. So it is definitely spleen chi deficiency. And as you can see, it's a little bit thin, the tongue thin and a little dry. It's slight blood deficiency, no? And the center is reddish. Do you agree? So there is heat in the stomach. And you see thin cracks at the sides. So there is now onset of spleen yin deficiency. But at this time, since you don't see the transverse cracks, um, the transverse cracks are not very apparent. So this is still spleen chi deficiency. Okay. So then the tongue, the anterior red of the tongue is red. So there is heat in the lung. So this one is the lung area. Okay. Heat in the lung, heat in the stomach. Let's go to the next case. 40-year-old male, symptoms, pressure pain under the ribs, depression, constipation, and fatigue. Western diagnosis, poisoning through pesticides. So maybe this patient is a farmer, no? Background to disease, pesticide poisoning. Okay. Um, let's describe the tongue. Okay. Actually, if you've been to Davao, this is quite common. There's Davao is famous for bananas. No, there's a very big banana plantation there owned by, and they would use pesticides by using the plane. They would spray pesticides using a Cessna plane. So can you imagine all the people on? So they will have this kind of tongue, no? Okay,
Mm.
so kawawa, di ba?
Yes.
Feel mo. Because they import, I'm sorry, they export the bananas pala. They export the bananas because they're very famous for bananas. Of course, I won't mention you the name of the owner. Okay, let's look at the tongue, slightly pale, slightly thin. So, if it's pale, so it's a deficiency condition, spleen Qi deficiency, with blood deficiency. And as you can see, it's thin, no? So automatic yan, blood deficiency. Then thin vertical crack at the center. So the presence of cracks will actually tell you that there is already some dehydration. So there is onset of fluid deficiency in the stomach. And the tip has red points. So when you see red points on the tip, hit in the heart. Okay. Next, 53-year-old female. Symptoms, chronic cough, expectoration of, this time the phlegm is not yellow, it's white. Okay. So you see, you need to be very precise. You need to be very detailed in your extraction of history. Okay. Nausea, exhaustion, painful lower back, insomnia. Western diagnosis, prolapse of the pelvic floor. Background, exhaustion due to work and personal pressure. Most likely this patient would lift heavy objects, no? Caring for a mentally ill son, so she might be so mentally affected here. Miscarriage at age 45. So the tongue is pale and swollen. So again, if it's pale and swollen, um, it's like
Inchit.
deficiency. Okay. And most likely the patient would feel cold. No? Pero hindi sinabi dito, but I think it's almost there, no? Slight pa lang. So you could still say that this is spleen deficiency. Crevices at the sides. Can you see the crevices, the cracks, no? So there is
Yes.
long-standing spleen deficiency. So you don't say spleen yin deficiency unless the cracks, the transverse cracks are very prominent, no? And yung history niya, hindi pa naman ganun kataas, kahaba. Okay? And then the coating is white and wet. So wet means cold, um, dampness, attacking the spleen. Okay. Next, the last case, 38-year-old female with severe mood swings, depression, exhaustion, soft stools. So if a patient comes to you with these symptoms, you have to always ask about the stools, no? In fact, the stools, the consistency of the stools will really tell a lot. Okay? Intense menstrual pain. So the Western diagnosis, anorexia nervosa. Then background to disease, sexual abuse, repressed emotions. And I usually see this in patients because they will not tell you they had this history, no? But after you needle do 24 and gallbladder 13, then he or she will reveal everything. Okay, try it. Okay, so the tongue description, slightly pale and thin. So this is very deficiency, blood deficiency with spleen deficiency, and the edges are curled up, no? So when it's curled up, there is liver chi constraint. Okay. And as you can see, it's so pale, no? Um, the sides are paler, so there's liver blood deficiency. And of course, you have deep cracks at the sides. Okay. Deep, but they're not so prominent. They're just malalim lang. Okay, if there are no questions, we proceed to the assessment. Can I call on Sir Mark?
Yes, Doc.
Very good. Let's do this fast. Okay, what does a cracked tongue body indicate?
Kapag crack po pinag-uusapan po is full heat and yin deficiency.
So there is heat, no? So if there is yin deficiency, you will not see a coating also. Okay, what about if the cracks are short, horizontal, or vertical?
Pag vertical po, Doc, is stomach yin deficiency.
Always because why did we not consider spleen yin deficiency? Because stomach yin deficiency, um, it of course much earlier, no? So
Yes.
what we're saying is stomach yin deficiency can have spleen yin deficiency later on. So these are like, so you need to also know the history. A long deep midline crack reaching the tip. This is also very common. What does this
Kapag ano po, um, tendency to hit pattern, Doc.
actually heart pattern?
Heart pattern.
It's a patient who's like if it's the midline crack is not reaching the tip, no? Nasa gitna lang siya. So that must be a patient with stomach issues, okay? However, this one is already reaching the tip. So we have a heart pattern, and usually these patients are very emotional. They're very sensitive. What
Yes,
about
sir.
a shallow, wide crack in the midline? Okay, it's shallow, but it's malapad.
Pag siya pinag-uusapan, Doc, is stomach yin deficiency.
Okay, stomach yin deficiency. Very good. Short transverse cracks on the sides in the middle section of the tongue. So this was our topic earlier.
Yes, Doc. Chronic spleen yin deficiency, Doc.
Or
Spleen yin deficiency.
yes, spleen yin deficiency. Okay. Middle section of the tongue. Okay. Middle section. Short transverse cracks. Okay. Quivering tongue.
Magpag-quivering po, Doc, is spleen chi deficiency.
Okay. Nanginginig konti. No? Small
Yes.
amplitudes. Okay. Deviated tongue body.
Interior wind.
Yeah. Kung hindi pa na stroke, you have to already do something. Okay.
Yes po, Doc.
So, um, checking the tongue is very, very important. What about a scallop tongue body? This is also like teeth marks, no? They are called teeth marks commonly.
Yeah, pag scallop tsaka teeth mark po is spleen chi deficiency, Doc.
Yes. Hammer tongue. Have you seen a tongue like this, Sir Mark? Parang siyang hammer.
Opo, Doc. Nakita ko na to sa mga taong sobrang pagod ng katawan. Ano to, Doc, pag hawak pinag-uusapan po, may pinag-uusapan sa internal to, spleen, stomach, and kidney deficiency, Doc.
Yes, spleen, stomach, and kidney. Or the patient may have mental illness. So if I were you, if you know somebody who has mental issues, you try to look at the tongue. Okay? I'm sure you know how a hammer looks like. Okay? So spleen,
Yes.
stomach, kidney deficiency. What about a curled tongue? Yung nakagano, yung yeah,
Pag naka-cart po yun, Doc, sa ano po, liver cheese stagnations, Doc.
okay, very good. Thank you so much, Sir Mark.
Thank you po.
Congratulations.